Okay, welcome everyone. It is 6 o'clock now, so we're going to go ahead and get started. This is the DSCC Health Insurance Education Series. This month, we're focusing on Medicaid eligibility and coverage. This is a three-part series hosted by UIC Division of Specialized Care for Children. Each month, we're focusing on a different topic. Last month, we did a presentation called Understanding Your Insurance, and you can find the recording on the DSCC website. This month, of course, we're focusing on Medicaid eligibility and coverage. And next month, we're going to have our last training in the series on understanding insurance appeals. So you can register for that training as well. And at the end, we'll have the links for you to go to the website to know how to register. I am Brittany Provost. I'm the manager of DSCC's Benefits Management and Research Unit team. We work with DSCC care coordination teams to help solve insurance problems. So I have a couple of other BMR team members here with me tonight. I have Amy Edwards and Renee Woodson, and you'll hear from them as well throughout the presentation. Just some housekeeping before we jump into the content and start talking about Medicaid. Captioning is available for this presentation. If you click the Show Captions button down at the bottom of your screen, the little CC, you'll see the captions appear. ASL interpretation is also available, so you should be seeing the ASL interpretation going on now. All attendees are muted. You were muted when you joined the presentation. So if you have questions, we want you to use the Q&A button to ask a question. So you'll see down at the bottom, there's that button that has the two little chat bubbles and it says Q&A. Click that and you can enter questions in. If you have a question where you need to talk to ask it, you can use the raise hand button and we'll save those questions for the end. But otherwise, if you want to type things into the Q&A, Amy and Renee are going to help monitor the Q&A. So we can answer questions as we go, but we're probably going to save most questions for the end. And you'll also notice the chat has been turned off. So you might be familiar with using the chat button to type into things. You'll see that you don't have the option to type into it because we want everything to go through the Q&A or for you to use the raise hand button. We are recording this presentation and the recording will be posted on the DSCC website likely in the coming days. We ask because it's being recorded and because others are listening in too, do not share any personal information in the Q&A when you're asking a question, or if you want to use the raise hand button and you get unmuted and you're asking a question, don't share any of your personal information because we want to keep your information private. We will email the slides to you after the presentation and they're going to be posted at the DSCC website. So when we email the slide, it's going to come from Zoom and it's going to have a link to go to the DSCC website where all the related materials and the recording and the slides are all going to be posted in one spot. Our agenda for tonight is to go over a brief overview of DSCC for anyone that's not familiar for who we are and what we do. We're going to talk about Medicaid eligibility and the different programs that Medicaid has. We're going to talk about what Medicaid covers, how to appeal to Medicaid if you don't agree with one of their decisions, and what happens if you have Medicaid and other insurance. And I'm just going to say as a caveat before we get started with the content about Medicaid, that Medicaid is not a DSCC program. We do not decide Medicaid eligibility. We do not decide the programs. So we're just sharing this information to help all of you and for you to learn more, but it's not our program and it's not something that we make decisions on. So a little bit about DSCC before we get started with Medicaid. So our vision is that children and youth with special health care needs and their families will be at the center of a seamless support system that improves the quality of their lives. Our mission is that we partner with Illinois families and communities to help children and youth with special health care needs connect to services and resources. We provide care coordination services through 4 programs. We have our core program that serves children ages birth to 21 with medically eligible conditions. We also have our Connect Care program, which is ages birth to 21 for children with special health care needs who are enrolled in a Medicaid Health Choice Illinois plan, so a Medicaid managed care plan that is contracted with DSCC for care coordination. And we're going to talk a little bit about those plans tonight since we're focusing on Medicaid. We also have our home care program, which is children or youth in need of in-home shift nursing, and our interim relief program, which is for children with eligible mental health or behavioral disorders. Okay, I'm going to hand it over to Amy Edwards to jump into talking about what Medicaid is.
Hi, everyone, and thank you for taking time out tonight to join us for this training on Medicaid. As Brittany said, my name is Amy Edwards, and I work here at the Division of Specialized Care for Children. So Medicaid is a health insurance program that is run by the state. Every state has their own Medicaid program, and they can all run and operate very different from each other. Tonight, we are going to specifically talk about Illinois Medicaid. So keep that in mind as we go through this, that certain things, other states may differ from how Illinois Medicaid works. Sometimes people will refer to Medicaid as a medical card or public aid. There are a lot of different names that you'll hear people say when they're referring to Medicaid. Medicaid is a program for eligible low-income adults, children, pregnant individuals, elderly adults, and people with disabilities. Anyone can apply for Medicaid at any time. There's no set open enrollment period that you have to wait for like other types of insurance programs. Medicaid will consider your application at any time of the year when you do apply for this. And later on in this presentation, we will talk about how to apply for Medicaid. All right, let's talk about what makes you eligible for Medicaid. Medicaid looks at a few factors to decide if you qualify. They will look at your income, and there are income limits that are based on the federal poverty level. And we will email you these slides after the presentation, and you can click on the link there where it says federal poverty level, and that will take you right to that chart so that you can review it and see if you would qualify for Medicaid based on that, if you had any questions. And in just a moment, we are actually going to pull up that chart and review it quickly. So keep in mind, if your child qualifies for the medical, fragile, and technology dependent waiver, this is also called the MFTD waiver, your income is waived for your child. And then to qualify for any of the Illinois Medicaid programs, you must live in Illinois and be a resident of the state of Illinois. So for some programs, Medicaid will look at your citizenship or immigration status. For children, they do not have to be a U.S. citizen or have a lawful immigration status, but for adult programs, there are some requirements. For most programs, Medicaid will not look at your assets, but there are a couple of specific programs where you would have to provide your asset information. Medicaid will look at assets only if they have to, and assets are things like having an extra vehicle, extra home. Sometimes they'll look to see if you have a savings account and extra money in that area, and those are things that could determine whether you would qualify or not. So here's the updated 2023 Federal Poverty Level Guidelines chart. A mouthful. These amounts get updated every year by the U.S. government. You can see the family size over here on the left. And then over on the right, you can see the annual income guideline. So for a family of 4, the federal poverty level is right at $30,000 a year. And we will talk a little bit more about how this works as we talk about each of the Medicaid programs we're going to go over tonight. I do want to mention that we're not going to be able to cover all of the Illinois Medicaid programs tonight, but we will talk about the more common ones. So before we start to talk about each of these programs, we wanted to go over some basic insurance terms with you that could apply to Medicaid or maybe in the past have applied to Medicaid. So a premium is the amount you pay for your health insurance every month. Most Medicaid programs do not have premiums anymore. A deductible is the amount you pay for covered services before your insurance plan starts to cover items or services. A deductible is also, it can vary from plan to plan and be different amounts. So if you've had different types of private insurance in the past, you may have had a high deductible or you could have a low deductible. But again, Medicaid programs do not have deductibles. A copay is a set amount you pay for a covered healthcare service. Most Medicaid programs no longer have copays in effect, but an example of a copay could look like you pay $20 to be seen at your regular doctor for an office visit, or if you went to a specialist like a cardiologist, you would pay $30. Coinsurance is a percentage amount you will pay for a covered healthcare service. Medicaid programs do not have coinsurance, but here's an example of how coinsurance would work. Let's say that durable medical equipment is covered at 80% by your insurance. You would have to pay 20% of that item for your coinsurance. So if you had an item that was billed at $100, your health insurance would pay $80 and you would pay $20. All right, so now we're going to start talking about specific Medicaid programs, and we're first going to talk about All Kids Assist. This program is for children through the age of 18. In July of 2022, Medicaid did away with the All Kids Premium 1 and 2 program and the All Kids Share program. So now all children that meet the family monthly income are put into All Kids Assist. The benefits are still the same and there are no out-of-pocket costs for covered services. The family income limit is 318% of the federal poverty level. That is almost 3 times the amount that we saw on the previous chart. This means that for a family size of 4, 318% of the federal poverty level is about $95,400 per year. We do have an income chart in a few slides that we will show you to give you a better idea of the income limits that that go for the All Kids Assist program and the different size with your family so that you can have a little bit of a better visual on that. It is important to know that children are not required to be a U.S. citizen or have any legal immigration status to qualify for Medicaid. Medicaid will look at their age, they make sure that they live in Illinois, and they will review the family income to determine if they are eligible. Next, we have family care, and family care is Medicaid for parents or caretakers with dependents under the age of 18. So to qualify for family care, you must meet the family monthly income limits. With this program, there are no asset limits. The income limit for this program is 138% of the federal poverty level. So this is much, much lower than the limit that they have for the All Kids Assist program. So for a family size of 4, 138% of the federal poverty level is about $41,400 per year. It is possible that the children in the family could qualify for Medicaid, but the parents do not because the income limits for each of these programs are different and they vary for each person and category. Another different thing about most adult coverage is that you must be a U.S. citizen or meet certain requirements for non-citizens. And with the family program, there are no copays, coinsurance, deductibles, or premiums. Now we're going to talk about the Moms and Babies program, and this is another Illinois Medicaid program. This program is for a pregnant individual, and it covers their care during their pregnancy and for the 12 months after they give birth. This program also covers the baby for the first 12 months after they are born. To qualify, you must meet a family monthly income limit. Medicaid will not look at your assets for this program. But the income limit is 213% of the federal poverty level. So it's slightly higher than the last program we spoke about, but it's still lower than the All Kids Assist program. So for example, to qualify for this program, a family size of 4 must make less than 213% of the federal poverty level, which would be about $63,900 per year. For this program, you are not required to be a U.S. citizen or meet certain requirements for non-citizens, and there are no copays, coinsurance, deductibles, or premiums with this program. Now we're going to talk about the ACA Adult Medicaid. So this is Medicaid for adults ages 19 to 64. And under the Affordable Care Act in 2014, states were able to expand Medicaid to adults that met the income limits. Before that, you had to qualify in another special category to be eligible for Medicaid. To qualify for this, you must meet the family income limit, and the income limit is 138% of the federal poverty level. So this is the same limit as the family care plan that we talked about a few slides back. Medicaid will not look at your assets for this program. So for example, for a family size of one, 138% of the federal poverty level is about $20,120 per year that you could make, or below that. Anything above that would disqualify you from this program. You must be a U.S. citizen or meet the certain requirements for non-citizens. And again, with this program, there are no copays, coinsurance, deductibles, or premiums. So now we're going to talk about the AABD program, and this is Aid to the Aged, Blind, and Disabled. This is a program for individuals who are blind, they have a disability, or they are 65 years or older. You must be a U.S. citizen or meet certain requirements for non-citizens. You must meet the family monthly income limit, and the income limit with this is 100% of the federal poverty level. So this is the lowest income limit we have seen with any of the programs that I've gone over tonight. Remember that Medicaid will determine which program you qualify for, so they will only put you in the AABD program if you don't qualify for another program that has a higher income limit. With this program, unlike the other ones we've talked about, there is an asset limit of $2,000 for a single person. So remember, assets are things like extra vehicles or extra homes. You are allowed one car and one home, and those things will not be counted against you. But other assets, like if you have a savings account, you would have to report that amount, and that could, depending on that level, disqualify you from this. So with this program, there are no copays, coinsurance, deductibles, or premiums. All right, the last program we're going to talk about tonight is Medicaid for Immigrant Adults and Seniors. And this is one of the newest Illinois Medicaid programs. This is Medicaid for immigrant adults and seniors ages 42 through 64 for the adult program. And then for the immigrant senior program, it's for ages 65 and older. As of today, they are still working on programs that would cover someone between the ages of 19 and 42 years of age. So as of today, just to clarify, there isn't a program for immigrants between the ages of 19 through 42 years of age. You must be a legal permanent resident for less than 5 years or an undocumented immigrant. If you are a legal permanent resident for more than 5 years, or if you have another lawful status, you could qualify for Medicaid in another program. You must meet the family monthly income limits, and that income limit is 138% of the federal poverty level. So for example, for a family size of 4, 138% of the federal poverty level is about $41,400 per year. That would be the cap on how much you could make in order to qualify for this program. And just keep in mind is that different family members can qualify for different programs depending on the age and immigration status. There are also no copays, coinsurance, or deductibles and premiums for this program. All right, so now we're going to take a quick look at the Medicaid monthly income limit for 2023. The income limits are updated each year. And in this column over on the left, you'll see where it says family size. And you can look at that column and decide which size your family is, how many people are living in your household. And then let's say you're a family size of 4. The most you could make per month for your children to qualify for All Kids Assist would be $7,950. For the AABD program, it would be $2,500. For the ACA adult program, it would be $3,450, and so on. So This is a chart that will come in the slideshows that we will send to you, and you can access this to review it, or you can find it online. Now Renee is going to talk with you about how to go about applying for Medicaid.
Hello, everyone. Thank you, Amy. I'm going to talk about applying for Medicaid. So to apply for Medicaid, the Medicaid program, it's several ways you can apply. You can apply online, which would probably be the simplest way to apply online at abe.illinois.gov. You can call the customer helpline at 1-800-843-6154. You can visit your local DHS office, also known as your Family Community Resource Center, and if you're not sure where the DHS office is located in your town or county, use the DHS office locator to find the office near you, and that's online. Now, Medicaid will decide if you qualify, and they have to decide within 45 days. They will send you a letter with that decision. Now, what happens next? After you've applied, you've submitted your application, and you get your decision back. If you are approved, they will let you know in a letter, they will let you know when your coverage starts, and they will give you a copy of your medical card. Now, I know medical card, you would think, I'm going to get a card. It's not actually a card, it's a piece of paper. So be very careful that you don't accidentally throw that piece of paper away. Now, if you're denied, you will also get a letter. It will tell you why you were denied. You could also be over income. If you're over income, they may consider you for a spin down. Now, we're not going to talk a lot about a spin down. It's pretty tricky. It's kind of confusing, but we do have a spin down tip sheet that you can refer back to later. And then also, if you're over income and not eligible, or if you just don't want that spin down, you might be able to get private insurance through the marketplace. That website is healthcare.gov. Now let's talk about the appeals process. Again, the appeals process is if they give you a decision that you don't agree with, when you apply or file an appeal, you're asking them to reconsider their decision. So if Medicaid denies your application, you have the right to file an appeal if you do not agree. Now, you must submit that appeal within 60 days when that application is denied. It's 60 days from the denial of the application. How to apply, how to file an appeal. The easiest way, again, would be online. And here's the website at abeillinois.gov/abe/access/appeals. You can also submit your appeal through a fax, through an email, but first you need to write a letter. Write a letter, make sure you have your documentation, keep your denial letter. Keep all documentation, all correspondence. That's very important when it comes to an appeal. And you can take it to your local DHS office, again, the Family Community Resource Center. You can call this number 800-435-0774, You can email that letter to dhs.bah@illinois.gov. You can also fax the letter to this number, 312-793-3387, or you can mail it to this address, Bureau of Hearings. Now let's talk a little bit about the redetermination process. Each year, Medicaid checks to make sure that each member qualifies for Medicaid. Now, it hasn't been done over the past few years because of the public health emergency due to COVID, but that's getting ready to start back up. So be checking your mail, make sure you don't throw anything away that's from your Medicaid office. Now, each family case may have a different redetermination time each year. Some people redetermination time may be May or June. Others may not be till December of this year, may not be till February of 2024. So you just make sure that when you get a letter, because they will send out letters, you pay attention to your date. Now, Medicaid checks residency, as Amy said earlier, income and family size. There may be other requirements as well. Medicaid tries to review as much information electronically as they can. So also, Medicaid may ask you for your information. If they can't figure out if you're eligible electronically, then they will be asking you for information. So again, they'll send a letter out asking you for what they need. They may need proof of your income. They may need household size again. So just be aware and make sure you get that turned in as soon as possible so you won't lose your coverage. There are many ways you can complete your redetermination. I have to say again, going online is the easiest way. And you have to set up an account called Manage My Case. Simple to do. We'll show you a little slide in just a second of what that'll look like. You can also mail your form back to Medicaid. You can call the customer helpline, or again, you can visit your local office. If you're one that wants to make sure you put it in someone's hands, then you just visit your local DHS office, the Family Community Resource Center. If you don't know where that is, go online to our DHS office locator. And this is what it will look like when you go on to abe.illinois.gov and you want to set up a Manage My Case. This is what it'll look like. And you just click Manage My Case. And you have to set up an account before you can use it. Okay, you can use Manage My Case online, again at abe.illinois.gov. Now, in Manage My Case, you can do more than just a redetermination. You can change your address. You can upload if they need your check stubs. You can upload your check stubs to give them proof of your household income. You can view notices. You can also file an appeal through Manage My Case. Now, let's talk about updating your address. This is going to be very important, seeing that the public health emergency is ending. Redeterminations are starting again. They won't be able to get your information to you if they don't have the right address. Go online at medicaid.illinois.gov to update your address. You can also call 877-805-5312. So you can report your Medicaid change of address. And this is how you do it. Now, here I'll give you some information on how to contact Medicaid, just in case you have some questions, need some clarification on things. You can call the helpline at 800-843-6143. They can answer questions about eligibility. They can answer questions about your Medicaid case, about your redetermination, and about applying for Medicaid. Again, you can also visit your DHS, your local DHS office, the Family Community Resource Center.
All right, we're going to talk about managed care now. So just so you know, you cannot enroll, I apologize. Sorry. This program is called Health Choice Illinois, and this is a Medicaid managed care program. When you enroll in managed care, you become a member of a health plan for your Medicaid benefits. You will choose a primary care provider. You may hear them referred to as a PCP, and this will be someone who works with your health plan. It's important that you know that you must use the managed care plan's network of providers. Most Medicaid members will have to or have already enrolled in a managed care plan. Medicaid will send you a notice telling you if you're required to select a plan and when you need to select it by. All right, you can't enroll in a managed care plan if you are in the DSCC home care program. You are not eligible to be in a managed care plan if you have private health insurance that covers hospital and doctor visits. So one thing to remember is Medicaid is most likely not going to be aware if you have private insurance unless you provide them with that information. And it's really important that you do provide them with that information because you don't want to be in a managed care plan and have private insurance as well, because that could create some issues with billing for providers and just create kind of a mess and a headache for you and your providers and insurance plans. So you're also not eligible to be in a managed care plan if you were in the spin down program. You aren't eligible if you are getting temporary medical benefits. You cannot be in a managed care plan if you're in the Illinois Breast and Cervical Cancer Program or if you are in a veterans care case. It's also important to know that if you are a Native American or an Alaskan Native, you have the option to enroll in a managed care plan, but you are not required to. Okay, so there are several managed care plans that you can choose from. Right now we have Aetna, Blue Cross, County Care, Meridian, and Molina. And keep in mind that County Care is only available for residents of Cook County. If you or your child is a DCFS Youth in Care, currently in foster care, they will be put in Youth Care MCO. Former youth in care that have been adopted through DCFS can choose if they want to be in youth care or if they want to select a different MCO. And like we said, depending on where your child resides, you can either have 4 choices or 5. So if you live in Cook County, County Care is an option up there. But for the rest of the state, you have Aetna, Blue Cross, Meridian, and Molina. Okay, if you are required to enroll, you will get an enrollment packet in the mail, and you will have to choose a health plan and a primary care provider for each member of your family. Each member of your family can have a different plan if you would like. So let's say you have 2 children and one child you want to enroll in Aetna and the other child you want to enroll in Blue Cross Blue Shield. That is something that's allowed, and you may make that choice depending on who their providers are and which plans your providers accept. If you do not choose the plan, Medicaid will choose one for you. So it's very important that you review your plans and choose the best one for you or your child. Once you make that choice, or once Medicaid makes that choice, you will be locked into that plan for 12 months. There is no way to get out of that plan. So we always encourage you to make sure that your doctors, pharmacy, medical providers, etc., are enrolled with the plan that you are looking at choosing. If this is a new enrollment, you will have 90 days to make one switch to a new plan if the first one doesn't work for you. Once you make that switch, you are locked into it. Even if you still are in that 90-day period, you won't be able to make another selection. After you make that switch, like I said, this is the plan that you or your child will be in for the next 12 months. There are two ways to enroll in a managed care plan. First, you can go online to enrollhfs.illinois.gov, or you can call 877-912-8880. Okay, so if you are in a Medicaid managed care plan, you can choose a new plan once each year. It's important that you know that this happens at a different time of year for every Medicaid member. So you may have a family member that can choose a new plan in November, and you may have a family member or a friend that can choose their plan in February. So it's very important that you are aware of when your open enrollment period is to make a switch to a new plan. Once you make that choice, you are again locked into that plan for 1 full year. The open enrollment period is based on when you first enrolled in managed care. So if you first enrolled in managed care on February 1st, 2020, your open enrollment is going to start around November of each year. There are two ways to check your enrollment time and choose your new plan. You can go online to enrollhfs.illinois.gov, or again, you can call 877-912-8880. And they are very helpful to talk with. I've called that 877 number before for work-related issues, and usually you get answered very quickly, and they're very helpful with letting you know open enrollment dates and your options. Okay, so you must use providers that accept Medicaid when you're trying to find a provider. It's important that you use in-network providers to make sure that your care or services are going to be covered by your Medicaid plan. If you have regular Medicaid, you can call the Health Benefits Hotline at 800-226-0768 for help with finding a provider. If you are in a managed care plan, you must use providers that are in network with your plan. So you will need to either call the member services number on the back of your insurance card to locate a provider, or you can visit your health insurance plan website, and typically they'll have a tab that you can click on that says locating a provider. Medicaid provides benefits for many medical services, and you can see more information on the What Does Illinois Medicaid Cover tip sheets, and we are going to look at that in just one moment. Medicaid also has coverage for other benefits like vision, dental, and prescription medications. Medicaid managed care provides the same services as regular Medicaid, and they may even have some additional benefits for their members. Medicaid or your managed care plan may need to give you special permission to get certain services. This is called a prior authorization or a prior approval. All right, what does Illinois Medicaid cover? So this is a tip sheet that we have put together for you. It's very important that you know that this is just an example. This is not a complete list of things that Medicaid covers. We just wanted you to have something to use as a guide. So you can see we broke down each section. We have medical services, medical supplies, durable medical equipment, and so on. And if you look under each one, it'll explain to you what is covered by Medicaid. So this is not the complete list, and it's important that you know that some of these services or items will require your child to have specific medical needs or a diagnosis to get them. Off the top of my head, one example would be diapers. Your child would have to have a special or specific diagnosis and be a certain age in order to have Medicaid covered diapers. Now, Renee is going to talk to you about how your Medicaid plan works when you have other health insurance plans.
So Medicaid and other insurance. First, you need to know that you can have Medicaid and other insurance, like private insurance, Medicare, or TRICARE, which is the military, active duty military insurance. Your other insurance will always be primary. They will pay primary, Medicaid will be secondary. You must follow both insurance rules. So if your primary insurance says you have to use an in-network provider, you have to use an in-network provider. as well if it's Medicaid says the same thing. You have to follow both insurance rules, using in-network providers, getting a referral when required, or getting a pre-authorization when required. If services are covered by Medicaid, this is very important, you should not be charged co-pays, deductibles, or co-insurance from your other insurance. And as Amy said earlier, you should always let Medicaid know if you have a private insurance. And I'm going to tell you how you can do that. You must tell Medicaid, of course. You can tell them by calling the third-party liability update line at 217-524-2490. When you do that, you need to make sure you have your Medicaid number for each member. You also need to have your insurance information ready. Press 1 for English, 2 for Spanish, press 4 for third-party liability. It's also a good idea to just have a copy of your card right there with you. You can also email the information to hfs.tpl.1442@illinois.gov. In that email, you need to put the member's name, the Medicaid number. You need to provide the insurance number. And again, it helps if you can provide a picture of the insurance card, front and back. Now, what do you do if you get a bill? If you have questions or concerns, you should ask your medical provider about your bill. Call your medical provider to ask them to explain the charges. The provider may need more information from you. Maybe they didn't have all the correct information. Maybe they didn't have the right Medicaid number. So yes, if you have a concern, be sure to call. Now, Medicaid or your managed care plan might have denied services. That may also cause you to have a bill. If the provider accepts your Medicaid and the services are covered by Medicaid, the provider cannot charge you a copay, coinsurance, or a deductible. If you don't agree with the bill, you can dispute it and just call the provider, call the billing department. Let's talk about an appeal when it comes to a service being denied. We talked about an appeal for a denial of your Medicaid application. Now we're going to talk about if your services are denied. This is what you need to do. An appeal is when you ask Medicaid, again, or the managed care plan to reconsider their decision. If your insurance is has denied services, you have the right to appeal it. You don't just have to say, okay, well, they denied it. We have to do. No, you can appeal it and they may consider it. If you have regular Medicaid, no managed care plan, you submit your appeal to Medicaid. If you have a Medicaid managed care plan, you would submit your appeal to by calling member services. You have to submit your appeal through your managed care plan. You must submit your appeal within 60 days from when they denied the service. Now, how to appeal to Medicaid. Again, online at abe.illinois.gov/abe/access/appeals. Write a letter and submit it to one of these ways. You can submit it by, again, taking it to your local DHS office, the Family Community Resource Center. You can call 800-435-0774. You can email it to dhs.bah@illinois.gov. You can fax it at 312-793-3387, or you can mail it to this address, the Bureau of Hearings, 69 West Washington Street, 4th floor, Chicago, Illinois, 60602. And remember, if you have a managed care, you have to call the member services line to appeal. And now we will hear from Brittany. Yes.
All right, yes. Last thing we're going to talk about tonight before we wrap up is the Health Insurance Premium Payment Program. This is also known as the HIP program. This program will pay for the private health insurance premium for some individuals with high medical costs and certain medical conditions. Basically, the state is going to decide if the medical expenses are more than the cost of the monthly insurance premium. They want you to keep your health insurance, your private health insurance, because your private health insurance is going to pay for most of the medical care. So if, for example, the premium for your child to be on your private health insurance is $200 per month, the state might say, well, spending $200 per month is cheaper so that you'll keep your private insurance and your private insurance will pay most of the bills. Where if you decide that your private insurance is too expensive and you cancel it, then the state knows that if you have Medicaid, they're going to be paying for the healthcare services then, because they're going to become the primary insurance. So you can apply to see if you can be considered for this program. If your child might meet the medical costs and conditions. It's kind of, they look at everything, kind of review the last few months of explanation of benefits from your private insurance to see how much your private insurance is spending, review your child's medical condition with some reports and letter of medical necessity, that kind of thing. So you can call the HIP hotline at 217-524-8268 to ask questions and request an application. And then we also have a HIP program tip sheet that's on the DSCC website that we've linked to, so that when you get these slides, you can go through and look at that and get a little bit more information about what information they ask for and kind of how to go about applying. Your child must have high medical expenses, like I said. So some conditions that might qualify as severe arthritis, cancer, heart ailment or defect, liver disease, kidney disease, brain disease, neurological disease, diabetes, AIDS, an organ transplant, and other, conditions that are high cost or might be chronic conditions. So if you think that you might qualify for this program or you're interested to see if you will, definitely go through the application process and just see, because it never hurts to see if, you might get that benefit of having your private health insurance premium paid for your child. And they're just going to pay for the people in the household that qualify. So if you have multiple children and 2 of them qualify for the program, they'll pay the premium. But otherwise, if only, one of your children qualifies for the HIP program, they're just going to pay the private insurance premium for that child. These are some resources. Some of them are throughout the presentation that we've reviewed, but we just wanted to put them at the end here so that you can go back and click on them if you want to look at more information. So the abe.illinois.gov website, which is where you can sign up for Manage My Case. You can apply for Medicaid, very helpful link. Then we also link to the Illinois Department of Healthcare and Family Services website and the Illinois Department of Human Services website. There is a brochure from DHS on the HIP program, and then the Client Enrollment Services website, which is where you can enroll in managed care or change your managed care plan if you're up for your annual open enrollment period and you want to make a new plan option. So just to summarize all the things that we talked about, of course, not everything, because we talked about a lot of things, but Medicaid decides if you qualify, and they review this each year through that redetermination process. So it's very important that you're watching your mail and submitting things that they request from you so that they can make sure that you're still eligible. Medicaid provides coverage for most medical, dental, vision, and medication needs. So the coverage that Medicaid has is very comprehensive. It's going to cover most needs. Most Medicaid members are in a managed care plan. Again, if you're with our DSCC home care program, you are not eligible to enroll in managed care. And you can have Medicaid and other insurance. So if you want to have private insurance or you have private insurance available to you through work, you can have that and keep your Medicaid coverage as long as you qualify based on those other requirements by meeting income, citizenship, residency, and that those other requirements. But just having private insurance isn't going to disqualify you from Medicaid. We've saved some time for questions, and I've seen some things come up in the Q&A and maybe a hand or two go up. So please use the Q&A button right now if you have questions, and we can look through them. And then if you want to ask your question out loud, you can use the raise hand button, and then we'll have to unmute you, and then you'll have to unmute yourself to be able to talk. It's a little bit kind of like a double unmute. So I guess, Amy, is there any questions in the Q&A that we didn't get to already that you want to talk through?
The only thing I wanted to see if you would explain is a question that we had about someone whose son is in their 30s. He's been on the MFTD Medicaid waiver since a young child, and they were wanting to know if he switches waivers, does he need to get a different Medicaid card and number? And I just wanted, I didn't know if you could explain real quick about how the Medicaid is tied to the MFTD waiver.
Sure. So in most of the situations, if your child qualifies for the medically fragile, technology dependent, the MFTD waiver, a case is opened just based on that waiver eligibility. So we work with the Department of Human Services and Healthcare and Family Services to kind of coordinate that program. So we don't decide the eligibility for it, but we work with that HFS to get the information over to them for them to make a decision. And so once they decide that your child qualifies for the waiver program, then we have the Department of Human Services, DHS, set up a Medicaid case specifically based on the waiver eligibility. So essentially, if your child is going to go to another waiver, your MFTD Medicaid would end, and then new Medicaid would have to be set up under a new case. Of course, be communicating with your care coordinator, your DSCC care coordinator, if that's something that you're interested in looking into. And Amy is actually the one that works on those cases, and she can kind of help communicate with your care coordinator to make sure that you kind of have as seamless of a transition as possible so that you don't have any lapse in your Medicaid coverage. So that's a great question.
One other thing, I wanted to see if you could go back by any chance and show the monthly income level chart.
I'm gonna go real far back, but yes, I will go back.
We
Oops, I
do
pressed
have a
it.
question asking if there's an income requirement for the HIP program.
Not that I'm aware of. It just, from my understanding with HIP, and again, HIP is not our program, it's just a program we really like to make sure everyone's aware of because it's a great resource. My understanding is that HIP looks at your child's medical costs versus the cost of your private health insurance premium. So they're basically looking at that. They're not really looking at your income and deciding, well, can you pay for your premium? And they're not kind of deciding, well, you can afford that, so you're going to pay it. They're looking at, is it worth it for them to pay the premium so that your child keeps their private insurance and that your private insurance remains the primary insurance to pay their medical expenses. I hope that makes sense. HIP is very complicated, so do feel free at the end. We're going to put an email that you can send questions to, and feel free if you want to get in touch with us, just submit a question and we can have a call and kind of talk through HIP or any of these other things that you might have questions on too.
We have a question that says, do you have to be pulled from PUNS for Medicaid coverage to start?
That I do not have an answer to. I'm not an expert in PUNS, but we can definitely take that back and try to get an answer. So if you, again, at the end, I'm going to show that email address. If you want to send that question to us, we'll make sure it gets to the right people so that we can share the answer with you.
And she added that her child is 19.
Okay. Yes, just if you can put that information when you send the email to us, because I don't want to have you share any private information. So if you'll just send an email, or there's a phone number if you prefer to call when we get to the end, I'll share that. I can actually go to it now. And that way we can kind of talk a little bit more in depth about that.
And we also have another question. My son was born with Down syndrome. We were denied coverage for Medicaid, and we were told he wouldn't qualify until age 3 due to income limits. Do you know if this is still the case?
That's interesting. I'm not sure what the caveat of age 3 would have meant. They're going to look at income and the program eligibility. So for a child, 3 they would look at all kids assist coverage and look at your income that way. So I think I would definitely recommend if at any point, and this goes for anyone, not just this situation, if you're ever denied Medicaid because of income, you can always reapply. So even if you had a change in income, and every year those income limits go up slightly, kind of based on the cost of living. And so you may have not qualified last year, but you might qualify this year. So I definitely recommend applying whenever you're curious if you might be, eligible. And additionally, if you're with DSCC, or if you're not, but if you're with DSCC and have a care coordinator assigned, you can always reach out to your care coordinator to say, we're not eligible for Medicaid. We wanted to see, can you review? Because your care coordinator then will come to us and we can kind of look into your case and see why it was denied and make sure the application was actually processed correctly. If you don't have a DSCC care coordinator, that's when you're going to want to use this email address to get in touch with us so that we can get your information and kind of look at it the same way, see what's going on, see if your application was processed, and kind of make sure everything looks okay.
Those were all of the questions in the chat box,
Okay. Do we
or
have
in the question and answer.
any hands raised?
No hands.
Okay. Well, we're going to wrap up by saying thank you for participating in our training. We really hope that you found it helpful. Again, we're going to email out the link to the slides where they're going to be posted and some of the related resources. So some of the resources that you saw us cover tonight, like the handout about HIP, the handout about what Medicaid covers, we put that all on the website in one place related to this webinar. So you'll see everything all in one place. The recording will be posted there too. At the end, when we close out of Zoom, there's going to be a survey that pops up. And if you can complete that survey, it's really helpful for us. It gives us a lot of information on what information you guys want training on going forward, and just knowing your thoughts on how this training went. And so if you do have any suggestions for future training topics, feel free to make those suggestions in the survey. And then the training is part of, like I said at the beginning, of the health and education series. So we want to make sure that if you want to attend future ones, you know how to do that. So the Understanding Your Insurance one happened in March. The recording's on the website. You can definitely go back and see it. This one for April will be on the website. And then our last one is about insurance appeals. So it's going to go a little bit more in depth about how to write an appeal letter, what information you should include in it, just kind of how to be thorough about the appeal process so that you might have a better chance at winning that appeal and having that service covered. And again, you can register and view all the materials for everything on the DSCC website here. And if you need to get in touch with us, this is the phone number, 800-322-3722, or you can email dscc@uic.edu. And then our website and our Facebook is also linked if you wanted to kind of just see what information we have put on our website. There's lots of resources on the website and lots of things get posted on the Facebook that might be good information to tune into. Thank you, everybody. We hope you have a great night.